Short Horse magazine, and today I'm here with the lovely Ed to talk to you about temporomandibular joint pain in horses, or TMJ pain in horses. Now, what is the TMJ? Well, it's the jaw joint of the horse, and there's one on either side of their head. Where is it located? Well, it's formed between the temporal bone of the maxillar or upper jaw and the mandible lower jaw. So that's how it's formed. And how can we locate it? If we take a line from the corner of Ed's eye here upwards, and from the base of his ear here downwards, right behind this bony protrusion here, in here, is your TMJ joint. Now, so we know where it is. Now, what are the symptoms of dysfunction within this joint? Well, the symptoms can be pain and inflammation around the area, horse quidding, losing chunks of food, horse being difficult to bridle, horse having just general difficulty chewing his food, horse head shaking while being ridden, or refusing to take up the contact while being ridden and finding it difficult to ride in an outline. So all of these are symptoms. Okay, so now we know where it is, we know the symptoms. What causes the problem? Well, the problem can be caused by a trauma. So if your horse gets kicked in the field, if he gets cast funny in the stable, or if he has a fall cross-country onto the head and neck, these can all cause trauma to the joint, causing pain and dysfunction. But a more general cause is the horse is a herbivore. And being a herbivore, he grinds his food, so there's quite a lot of movement in the lower jaw. He grinds his food on his molars, which are his back teeth. Now, over a period of time, when he's grinding, the teeth become sharp. The molars become sharp on the outer edges of the top teeth and the inner edges of the bottom teeth, so the teeth become sharp. Now, this can negatively affect how the horse chews, causing pain and dysfunction within the joint. So that can be a cause. So not getting our horse's teeth rasped regularly can be a cause of the problem or pain in the joint. What other causes? Well, ill-fitting tack. A bridle that's fitted too high in the horse's mouth or too low in the horse's mouth can cause problems. Poor riding, for instance, a rider that's always hanging out of one side of the horse can cause a problem within the joint. Equally, if we're lunging off the bridle and we pass the lunge line through the back of the bit and hook it onto the other side, this can negatively impact the mandible, causing problems within the joint. So if we must lunge off the bridle, pass the lunge line up through the bit over the top of the horse's head before clipping to the bit on the far side. So lunging off the bridle can cause a problem. What other issues can cause dysfunction in the joint? Well, infection in the joint, which can be caused from a horse receiving a prod in the field. So these are all the causes. Okay, so now we know what causes it. What do we do about it? How do we get a diagnosis? Well, the first thing you'll do is call your vet. And the vet will examine the area to see, looking for pain and dysfunction. He'll also move the mandible to see if he can elicit a pain response within the horse. He'll listen to your symptoms that you've been telling that the horse has been having. And if he feels that there is pain or dysfunction within the joint, he will use a small amount of anaesthetic. He'll inject it into the joint and see if that improves the symptoms. If it does improve the symptoms, he will confirm his diagnosis based on that. So that's how it's diagnosed. Now, for more severe cases where the horse has had a blow or a kick from a horse in the field or a fall cross-country, the vet may x-ray the horse. He may even do MRIs or CT scans, which would be done under an anaesthetic. And they can yield very, very good results for diagnosis. So that's diagnosis. Now, what happens as regards treatment? Well, for treatment, the treatment will be based on the cause of the problem. So if it's a blow from the horse getting kicked in the field, or a fall cross-country, and there's actually a fracture to the jaw, the horse may require surgery, a lengthy convalescence, followed by pain and anti-inflammatory medication. So that would be the treatment in that case. If the vet thinks it's just a mild strain of the joint, he will probably give you a small period of rest, followed by pain and anti-inflammatory medications. And if there's infection in the joint, the vet will give you antibiotics, followed up with some pain medication and a period of rest also. So they're your treatment options for the joint. So what can we do as equestrians to prevent problems within the TMJ? Well, the main thing we can do is we can have our horse's teeth floated at least once a year, preferably twice a year by your dentist. This keeps the molars nice and level so that when your horse is chewing, he's not going to negatively impact this joint. The other thing we can do to make our horses feel more comfortable is to make sure that our bridles fit correctly and the bits fit correctly. And as riders, we can do our best to be very balanced when we're riding our horse, not hanging out of one side of them more than the other. So if you feel that you're tight as a rider in your body, and you feel that you might be negatively impacting your horse, make sure that you get yourself corrected by your chiropractor or your massage therapist to make sure that your body stays balanced and in alignment. The other thing that we can do is when we're lunging our horse, never pass the lunge line through the back of the horse's chin and clip it to the far side. If we must lunge the horse off the bridle, make sure to use the lunge line up over the top of the horse's head and clip it to the far side. So they're all prevention. So that's TMJ dysfunction in a horse. You know what to look for, you know how to locate it, and you know the symptoms and the treatment plan. We hope you enjoyed this video today, and if you liked it, can you please subscribe and hit the notifications bell so that when we upload a new video, you will get a little message. So once again, thank you from the beautiful Ed, who's terribly bored, and myself today, and thanks for watching, and we'll see you again soon.